Hi, I'm Dr. Lee Sheldon. Let's talk. I established this practice in 1980, and when I established it, I said I'm going to do it the way I want to do it, doing it the best way I can for my patients. I wasn't necessarily insurance friendly. I was patient friendly. I wanted to be able to have conversations with the patient. I wanted to be able to spend time with the patient. And I wanted to be able to do the work that I needed to do for the patient in order to be able to make sure that I was doing the best job I could. Now, I'm sure everybody feels the same way. But I had certain criteria, and those criteria couldn't be compromised. So there are times when I hear I can get it cheaper someplace else. And I think the real question is, what is the it? Talk about the treatment that you may need. The it may be a crown. It may be an implant. It may be full mouth implants. It may be periodontal treatment. Whatever the it is, the it isn't really the it. The it presumes that everyone does it the same way. The it has very much to do with who. Who's doing it, the training, the technology, the talent of the individual that's doing it. We all know that there are more talented individuals in every field than in others. When I ran this practice, I concentrated on hiring great talent and then training them. And I'm proud to say that within this practice, even though I'm no longer the owner, the doctors, Dr. Furtado and my son, are doing things the same way. They're hiring talent and training the talent and providing the best technology, including the best support people to be able to do the work in the best way they can. The it is the who. The it is the how. Implants, for example. There are 40 different brands of implants. They're all good. But how the implant is placed, the assessment of the bone, making sure there's enough of the correct soft tissue and the correct amount of bone around each implant is what determines the longevity of that implant. So it isn't the implant, it isn't the brand of the implant, it's the surgeon placing the implant and designing the implant surgery in such a way that that's done predictably. How about a crown? A crown isn't a crown. You don't just go to Walmart or Amazon and pick up a crown. The crown has very much to do with how the tooth is prepared under the crown. That determines whether the crown is going to stay or not. It determines what the bite is going to be like on that crown against the adjacent tooth. It determines whether the crown preparation, how we grind the tooth down for the crown, either helps the periodontal structures, meaning the gum and the bone, or it doesn't. There's a lot that goes into it. When it comes to periodontal therapy, in the year 2000, I decided, after having practiced periodontics in traditional ways for 20 years, I said, we can do this all non-surgically. I need talent, and I need technology to do that. So I bought one of the first endoscopes on the market. And I had a hygienist who was willing to fight to learn to use that endoscope to accomplish everything that could be accomplished without doing surgery. That was the amazing part, is that ordinarily we would do non-surgical treatment and then surgical treatment, and you do a reevaluation in between. And when we were doing the non-surgical treatment and I reevaluated, there's no longer a need for surgery. It's the who. It's the talent. It's the instrumentation. It's the ability. It's the standards of the doctor and the standards of the office and the standards of everyone that's here. My whole thrust in this practice, and I'm proud to say that's the thrust that's carried on in this practice, is that we do everything we can to make sure that it's done the right way.